My name's Dr. Nicholas Ashton. I'm the Senior Director of the Fluid Biomarker Program at Banner Health in Arizona, United States. My research looks at developing blood tests and other tests for Alzheimer's disease. Last decade, we've been trying to establish easier ways to diagnose Alzheimer's disease. My work has been to do this through blood. So to try to detect molecules in blood, which means that we know that Alzheimer's disease is developing in the brain. So we've achieved this in the last decade. We have very highly accurate tests to detect a molecule called phosphorylated tau, which tells us which individuals that come into our clinics have Alzheimer's disease or a different type of dementia. My biggest achievement, my biggest excitement around this field is being able to develop a blood test for Alzheimer's disease, measuring a particular protein called phosphorylated tau 217. We started this about 4 or 5 years ago, and now we're at the position where clinicians and doctors are starting to use this as a routine test to diagnose people. This has developed extremely quickly, and it's due to an amazing advancement in our understanding of the disease, but also our advancement in technology. We have a great challenge in that we understand Alzheimer's disease much better than we have done. But when someone comes into a clinic with memory problems, it's not just Alzheimer's disease that's causing those symptoms. There's a whole range of different proteinopathies that develop in the brain. And we need to have ways to make a risk model, let's say, for those that have different types of dementia. Now, NULISA, with their multiplex panel and their ultrasensitive detection in small volumes, gives us a very broad look of what's happening in the blood. So not only can we look at specific markers like phosphorylated tau, which we understand a lot about, but we can look at a whole host of other markers that tell us about brain health. So that gives us a much wider and clearer picture of how an individual is performing and what type of disease they have, and what's their prognosis and how they're likely to respond to treatment and what management we should give them. A remarkable aspect about NULISA is that, as I've mentioned this protein phosphorylated tau many times, you are getting the same accuracy and the same sensitivity of that biomarker compared to best-in-class single molecule markers that are used in clinic, with the addition that you're getting 120 additional biomarkers. So the sensitivity and the reproducibility of that is unparalleled. Some biomarkers that are included on the ELISA panel are markers that we haven't been able to measure in blood before, and we're able to do this just with this ultra-sensitivity detection. So we're starting to understand molecules that we've been wanting to see. Now we're starting to get some information in our research cohorts, and we can start to deduce what they mean to the patient and what they mean to their disease progression. As I've mentioned, we've been extremely successful at developing tests for one protein. And Alzheimer's disease is much more complicated and heterogeneous than just one protein. What we want to try and avoid is using several different tests to measure several different proteins at different times. So what the NULISA offers us is to be able to characterize hundreds of proteins all in one sample, including biomarkers or molecules that we understand a lot about, like phosphorylated tau and neurofilament light, but add this extra element of multiomics, a lot of information at one time, all in one shot, which gives us a much better profile of the individual that we're seeing in front of us in a clinic. From a practical sense, the NULISA is a very easy technology to manage, so it can be used in routine work. In my lab in Arizona at Banner Health, we're also using the ELISA platform to develop our own assays. So we're not restricted to what is on the panel. We have our own targets of interest, and we can use the ELISA platform to actually make a homebrew assay, and make custom assays for proteins that we think are important. So that gives us a whole broad range of what we can use the instrument for, not just for panel work, but for guide our own independent research. At Banner Health, we are trying to unpack what is happening with Alpha-Synuclein, TDP-43, vascular pathology. These are all very common pathologies that we see in patients' brain when they go to postmortem or when they die. What we need to be able to do is capture these pathologies in life, just like we have done for phosphorylated tau. So what my work, and guided by NULISA, is hoping to come up with a risk profile in individuals. How much is TDP-43 contributing to your disease? And how do we manage that in that individual patient? And we'll be able to come up with this because of the global proteomic approach and ultrasensitivity in NULISA. We're starting to unpack which proteins are important to disease progression, which proteins are important to which proteinopathy, and that will give us a much clearer and better way to manage patients on a personal level. In an unparalleled time in Alzheimer's disease, where we have drugs that are approved that modify the course of the disease. And we have blood tests now that are able to recruit these people effectively to say who should get them. What we don't understand yet is who is the most likely to respond to those drugs, who is going to progress quicker, and who's mostly likely to respond. And a multiomic proteomic profile like NULISA will help us understand, again on a personal level, who should receive those drugs, how long they should receive them for, and even if that drug is correct for that right patient. This is going to be a multi-omic approach. It's not going to be based on a single few markers. And NULISA, in combination with the data that we're getting and output from these trials that have been performed, we'll be able to have a much personalized approach, not only to diagnosis, but also to treatment. There is a want now for individuals to take control of their own health. And therefore we need approaches and personalized approaches to guide individuals about how their future and how their health is going to look like in the future. So there is going to be a need of brain health profiles, healthy living. We are in an era of disease-modifying drugs. And we need a way to be able to give individuals a good outlook and profile for what their brain health looks like. And this multi-omic approach like NULISA will really set us which molecules are going to be the best. Now, my personal approach in research is that we're going to use NULISA to understand which are the key biomarkers. And then we hope to be able to develop a homebrew assay in NULISA which is quantifiable on a small set of biomarkers, not maybe 120. But we need this global approach to start off with to really refine what is the most important biomarkers for brain health.